Okay, thank you, Mr. Chair. I must start out by saying that I'm not used to sitting on this side of the table, so I hope you'll treat me gently. Thank you for your warm welcome, and I'd also like to begin by thanking Senator Atulajan for sponsoring this bill in the Senate. I'd like to begin by briefly describing the journey that led me to Bill C-300. In March 2008, a young woman from Brampton named Nadia was suffering from postpartum mood disorder and insomnia. A student here in Ottawa, she felt isolated and sought help online. Instead of help, Nadia found a predator. Instead of comfort, she was encouraged to hang herself in front of a webcam. Instead of finding a friend who would encourage her to find help, she found a predator who entered into a suicide pact with her, a pact she completed 4 years ago this month. It turned out that the young woman with whom Nadia thought she was communicating was in reality a middle-aged man, a middle-aged nurse from Minnesota who posed under an online pseudonym and was linked to numerous other suicides in several countries. It seemed that the digital nature of the crime was impeding prosecution. When I met Nadia's family, I quickly understood their pain and how their pain was extended each day and how they were denied closure. That led me to introduce Motion M388, which called on the government to address in the criminal code the barriers that law enforcement agencies faced in Nadia's case. That motion passed unanimously in the House of Commons in November of 2008. Through discussions on Motion M388, I met many people working on the front lines who tried their best to educate me on these issues. I met many Canadians affected by suicide who shared their pain with me, and I started to pay attention in a different way. Obituaries for young Canadians that didn't list a cause of death stood out to me like never before. Then one day, I looked at my BlackBerry to find an email with news that in the space of just 1 week, 3 students from Waterloo Region schools had died by suicide in unrelated incidents. If there's a single thing, one single occurrence to which I would attribute my reason for introducing Bill C-300, it would be that conversation. I've learned so much about suicide, its causes and prevention methods through this time. I'd like to focus now, though, on what we don't know. It's estimated that on average 10 Canadians die by suicide each and every day. That number in and of itself is terrifying, but we don't know how accurate it is. We know that the stigma surrounding suicide causes underreporting, but we don't know how severely or in which communities the underreporting is most severe. We know that suicide is most often preventable. As I stated in the preamble to Bill C-300, it's preventable by knowledge, by care and compassion, but we do a poor job of sharing the knowledge accumulated regarding suicide prevention. We do a poor job of sharing it with those whose care and compassion compel them to continue working to save lives. Finally, we know that addressing this challenge will require collaboration across jurisdictional, geographical, sectoral lines, and increased lines of communication between agencies. But we also know that between 1993 and the most recent election, only one piece of legislation relating to suicide prevention was introduced, and that private member's bill never reached second reading. We know that this is a national issue, but we struggle to define the appropriate federal role. I was pleased to see that you have also included today legitimate experts appearing. I am not an expert in this field, only an advocate for the experts, an advocate for the volunteers and the counselors who are working on the front lines. I remain grateful for this opportunity and for the work that you do. It's my hope that through the timely passage of Bill C-300 into law, hope will be given to the many prevention and recovery groups already doing great work with shoestring budgets. We can increase their knowledge, expand the awareness of suicide as a public health issue, define and promote best practices, and finally begin to collect accurate data and statistics. The statistics we have are understated, yet overwhelming nonetheless. There are, on average, more than 4,000 deaths by suicide in Canada every year. There are 400,000 attempts. There are 20,000 hospitalizations due to suicidal behaviors and 88,000 emergency room visits. The average Canadian is 7 times more likely to die by suicide than homicide. Just last week, the Ottawa Citizen printed the story of Dennis Farrell. He was struggling with many issues and was considering death by suicide. He reached out for help to friends who got him checked into a hospital. Yet barely 24 hours later, he died by suicide. This story, while spectacular in some of its details, is all too common. We know that suicide is a public health issue, but we have developed no best practices to treat it as such. Teachers in a position to recognize suicidal behaviors are rarely trained to do so, and it's uncommon even for medical doctors and nurses to receive specific training in this area. We know that there exist in our society groups who are more vulnerable to the threat of suicide than the general population. Veterans and Aboriginal Canadians are notable, but we struggle to develop suitable evidence-based responses. Through good prevention initiatives, ultimately, hundreds of Canadians who may be vulnerable, who may find themselves temporarily in desperate circumstances, will find the hope to continue instead of making an irreversible mistake by trying to solve their temporary sense of despair. I've often quoted Margaret Somerville, who said that, quote, "Hope is dependent on having a sense of connection to the future, even if that future is very short-term. Hope is the oxygen of the human spirit. Without it, our spirit dies," end quote. I believe Bill C-300 will be a foundation on which to build that hope for vulnerable Canadians. Just as importantly, its passage will deliver a message of hope to those working on the front lines of suicide prevention. Thank you very much, Mr. Chair.
Well, thank you.